rounds was fantastic. So say I'm a patient with, and I'm told I have a disc issue in my back. What's the message? Like, what would be the most important things for patients to know about disc problems specifically in their back?
Having had one myself,
that was a great little story. I love that, by the way.
Well, I can tell them that I relate. I know they're painful. They can definitely be a thing that sets you back. It causes you to move differently. Can disturb some of your normal activities. But I think one of the most important things to realize is that with time, a lot of disc injuries can heal. Yeah. And there's lots we can do in the meantime where we can modify positions or change activity levels that will help people get through it. And they'll see that light at the end of the tunnel and know that they can recover. It's not always a surgical case. Sometimes it is, but there's so many things we can do in the meantime to help them get by. So I think that's from a rehab standpoint, that's one of the more important messages about discs.
My wife is actually going through a disc herniation right now, L5S1. It's been about 6 months, right? And at the beginning, very aggravating. I kind of maybe didn't take it the right way at the beginning. I told her, well, let's not do much. She loves weightlifting. Let's not lift any weights. Let's just do some maybe yoga and stretching at the beginning, and it was really hard for her, right? It kind of took some things out of her life that she really enjoyed, and yes, that's probably good to not be lifting weights at the very beginning when it's really irritated, but also we have tools to be able to help people keep doing the activities that they want to do and modifying those things, right? As long as we're not irritating symptoms and keeping them active, making their lives a little bit bigger so their pain is maybe not as much of a problem.
Yeah.
Right?
Those are some of the messages that I think are really important to hear. Describe what people sometimes do here that are not what we think the most accurate or the best messages, things that might make them more fearful than they need to be.
One of the really common narratives that we run into out there is that a disc is like a jelly donut. And I can see where that came from, right?
Yeah.
There's a softer middle and a little more firm exterior.
And I'm guilty of using this example just as in a simplified version of.
Sure.
Yeah.
And I get it. I see where that came from.
Yeah.
But I think inherently in that message, it makes people think about the donut itself. It's soft and it is really compliant and it is easily damaged.
So let's go ahead and
should we look at
demonstrate
that?
the jelly donut, because in one respect there is an outer annulus and an inner nucleus. So there's an outer shell and an inner core, and in that respect there's similarities. But a disc is not a fragile structure like you're about to demonstrate. Like, you push on it a little bit and it oozes out. So go ahead and show us what the jelly donut would do.
A jelly donut is really soft, right?
Yeah.
It's got a jelly fill, and it you push on that and all of a sudden out comes the innards, right?
Yeah.
And I think patients worry that even with a small movement of where I bend and I load my disc, I'm at risk of something like that happening.
Yeah. And I liked your new analogy that we should think about, which is a tire. So tell us a little bit about that.
Yeah, so like John, right? Discs are very robust, right? They're strong, right? In some cases it's to where that herniation is pushing on a nerve and irritating things, and we need to intervene, right? But patients need to realize that it may be like a tire, right? A truck tire, strong tire with gum in the middle, right? That it's not just going to ooze out, right? And hopefully help them feel that these things they're strong, they're robust, and they're not just going to, when you bend down and tie your shoes or sneeze, right, it's going to ooze out, right?
We realize that disc herniations do happen, and sometimes they are surgical, and the nucleus can be kind of toxic to nerves if there is indeed a herniation or extrusion. So it's a painful thing, and those are worst case scenarios. A lot of times, though, these are very manageable conservatively, though.
I like the tire analogy. You think about how many thousands of miles we put on our tires before they have to be replaced, and in the case of a disc, we're putting on many more thousands of miles and many, many, many more years on our discs before they run into any issues. And oftentimes you'll have a patient that's in their 60s, 70s that has a couple of disc issues, but the rest of the discs look pretty healthy. So those discs have been around for a long time and withstood a lot of mechanical strain and stress. So they are a resilient tissue, resilient structure, sometimes need treatment, but they're not as fragile as what you're demonstrating here.
I've loved it when I've seen pictures of MRIs that show a fairly large herniation, and then they get a follow-up MRI, and that herniation is resolved.
Yep.
That happens often.
It does. It does. The randomized controlled trials have demonstrated that if a patient has a disc herniation and it's been less than about 4 months, they're better off with conservative treatment. And if it's been longer than about 4 months, if their symptoms are still pretty severe, they're better off having surgery and continuing with conservative treatment, because a lot of the disc herniations that occur, the body will naturally just kind of melt away, and they no longer will affect the nerve. And the other thing I would say is, in the case of this jelly donut, you can see that the donut's a lot flatter. With a disc herniation, you're probably only talking about 3 or 4 or 5% of the overall structure of the disc. Like, it's not actually that. The disc is a big structure, and a herniation, unless it's like filling the entire spinal canal, which is super rare, is not actually that much of the disc. So there's still a lot of disc that's functioning normally in there.
And unfortunately, I was going to say, in some cases, I mean, what we can say is that a disc is not necessarily like a tire, right? We don't have to always replace it, right? And then also, with the research that we showed, that they respond to load, right? Cyclical loading, we can make these discs more robust and adaptable, right?
Yeah. That's one thing that I think is really important, is discs get their nutrition with movement. They don't have blood supply. It has to be loading and unloading, driving fluid and nutrients through the end plate of the vertebral body. And so movement is actually the best thing for discs. And the situations I have seen the most rapid disc degenerative changes occur have been in patients that are in bed because of an illness and are not able to move. That's when they have the most degenerative changes.
We talked about discs respond to the loads we put on them, but also to the loads we don't put on them. So it's that principle.
It was a great message. One final concluding thing that I would say is, and it comes from Michael Easter's Comfort Crisis book. It's a great book, but he talks about how historically we had to do a lot of things in nature. Most people lived in environments where they weren't sitting all the time, or they weren't doing the same repetitive tasks all the time, and were more movement generalists. And then yesterday we posted Courtney Wayment's Ortho Night talk, as she was at that point in time preparing to compete in Paris Olympics and as a steeplechase runner. And she described, and I was reminded of her workout routine, and she did a lot of running, but then she also cross-trained. And I think that in our day-to-day lives, we want to be movement generalists. Mix it up, do different things. Some of us are sitting a lot, some of us are doing repetitive movements a lot. And that can increase repetitive strain to any particular part of our body. So the counterbalance there is to just go and do something different. Change
position, get up, move around, adapt, load things up under the levels of tolerance that you have, and that can definitely make you more functional.
Thank you so much for speaking this morning. It was fantastic.
Thanks
really appreciate you guys.
Thanks for having us.
Appreciate it.